Let's come back to our top story this morning. British Columbia ready to roll out vaccine boosters for all eligible people in the province, the general population. It announced yesterday it is planning to offer third shots by next May, starting really early, even earlier in the new year. The first province in Canada to announce boosters for the broader public. BC's already been giving the shots to people who are immunocompromised, who are in long-term care, who are in remote Indigenous communities, and of course, many are also offering them to those who are 65 and up. So most British Columbians will be able to get their third shot 6 to 8 months after their second dose. That is our starting point this morning for our conversation with Dr. Samir Gupta, regular contributor to our program, a respirologist and associate professor in the Department of Medicine at the University of Toronto. Good morning, Dr. Gupta.
Morning, Heather.
British Columbia leading on this once again, not just the first province in Canada, but believed to be the first jurisdiction in North America, Dr. Gupta, to make the booster available in the new year to the general population. So I'm wondering your thoughts in general on this move.
Yeah, as you say, it's a very liberal policy. My thoughts on this, I would have rather seen a coordinated national approach to this problem. I would have rather seen something from the NACI that the provinces would then follow, rather than one province coming out in this way, because it might have a domino effect and it will create pressure on other provinces. And to my mind, it's not even a scientific debate anymore. We know the science. It's quite clear that after about 6 months, there's a little bit of drop-off in immunity. That drop-off is not actually, it doesn't put you at a significant risk if you're an otherwise healthy person. But if you get a third booster, there is a small benefit. There is a small reduction in that increased risk that you face. But relative to using that same shot as a first shot in someone else in another part of the world where they don't have enough vaccine, there's a much smaller benefit in using it in a healthy person here who's fully vaccinated as a booster or third shot. And that's why I think it's a bigger question. What's our role in the world as a rich country kind of awash in extra doses? At what point should we be helping other countries to get through this pandemic, as opposed to using all those doses here for people who are already very well protected?
It's such an interesting perspective, and one we've heard from global health officials, notably at the WHO. Dr. Henry, the top doctor in British Columbia, making the exact point you did, Dr. Gupta, that it is that not everyone needs it now, but they are starting to see that general decline, that waning immunity somewhat, so they anticipate we will need it in the new year. And something else that was interesting to me, just as we anticipate this, is that whatever shot anyone got for the first or second dose, it will be an mRNA vaccine that people get as the booster.
Yeah, and that's the same policy they put in place in the U.S. It's a policy that makes sense. Here, as you know, we've been mixing and matching first and second doses. So it makes sense, at least from a theoretical point of view, in terms of how these vaccines work, to say that it's perfectly fine if you are going to get a booster to get an mRNA booster, and not really important whether you mix mRNA shots or whether you mix an AstraZeneca with an mRNA, similar to our philosophy around second shots. But really, the question is what's the right population for this to be done? And is it people over 65 like the US? Is it a little bit higher risk people over 60 like we saw in the trials from Israel? At some point, is it everyone? But is there a period of time in between where we focus on getting other parts of the world at least to a reasonable level? 5% of people in Africa are fully vaccinated. So there's this massive disparity. And I think that's where I would like to see more discussion and consideration.
We will see whether other provinces follow suit and follow the BC example in due course. Something else we were paying close attention to yesterday, that vaccine advisory panel for the FDA meeting, discussing and voting ultimately to recommend Pfizer's vaccine for 5 to 11-year-olds, recommend it for emergency use authorization, and the FDA itself will be making a final ruling on this in the coming days. What was interesting to me were the comments from the panel members, Dr. Gupta, because they all said it was a much tougher decision for them. They had a very vigorous debate because obviously this is something that affects millions of children. Eventually, though, Dr. Gupta, they did decide that the benefits outweigh the risks here.
Yeah, I think that's the key here, Heather, is that the risk-benefit ratio is more closely balanced in kids. We know that kids are less likely to get very sick from this virus. So to some extent, this is about getting closer to herd immunity It's about protecting not only kids, but protecting those around them, and getting us through this as a society by vaccinating a part of the population that can pass this virus around and pass it on to other parts of the population, though in itself, those kids have a lower risk. That part of the population in itself has a lower risk of getting very sick, though not a zero risk. And I will say that, these are just numbers, they're just statistics until it's your kid. And kids have gotten very sick. Just about 1 in 1,000 kids ended up in hospital in the recent wave in the US. Who had the virus, and kids have died from this. So I think that's where the risk benefit has to be weighed. And we're at a point where 3 billion adults, 3 billion people, 12 plus at least, have gotten this shot around the world. Mm-hmm. And we have a very good understanding of how it works and how safe it is. And I think to some extent, you do extrapolate those data. You have data in children, but it's a relatively small trial, and you do have to look at our experience in the world in older people and take some reassurance from how well we've done and how safe it's been.
Well, you used the word reassure, and that was exactly what we heard from the experts. One of the things that reassured them was there will be a lower dose used for children, 1/3 of the adult dose, and they were also reassured at the fact that side effects, there'll be pretty vigorous monitoring of side effects even after there's approval, particularly for that rarest of side effects, the myocarditis. But are those things that, as you look at what they found, and as a parent and what Canadian parents, because Health Canada looking at this too, these are the kinds of things that would be of reassurance to you too?
Yeah, very much so. I think when you look at the trials were designed to show that kids will have similar, comparable antibody responses to older people 12 plus and adults. And it turns out that 1/3 of the dose was sufficient to give them those antibody responses. Later, we'll get bigger trial data on how protective it is from actual infection, but it's reasonable to extrapolate that if you have a comparable antibody response to an adult, you will be protected. Now they're also telling us that it's 90+% effective at protecting, so we have preliminary data on that. We haven't seen these data, but it's very reassuring that a large independent panel is looking at these data and saying it should be approved. The thing is, it's a smaller trial. It's a smaller trial than the 40,000 or so people who were in the original Pfizer trial. This is a few thousand kids. And the reason it's smaller is the thinking is we have this massive worldwide experience with this vaccine. What we need to be able to show at this point is that kids respond with a similar antibody response and that nothing bad happens. And that's what we saw in this small trial. But like you say, as it rolls out to now millions of kids, we are going to want to continue that monitoring in case there are very rare side effects that you only see when several 100,000 or several million people get the vaccine, which was the case with myocarditis. And that's something we're going to want to observe. That was something that was higher in young adults, though, than in adolescents even. So there's a good hope that we won't actually see that in kids. But we have to monitor, and it is reassuring that there will be a very robust monitoring after release.
These would be the kinds of questions that Canada's regulators are looking at as Health Canada also reviews Pfizer's proposal for kids. And as we know, Saskatchewan yesterday, Ontario yesterday, 2 of the provinces already saying they are planning actively for when that approval comes, anticipating it will. Talking about Ontario and vaccination plans, let's pull this up because, Dr. Gupta, I could not help but notice your tweet last night. We got, at the end of last week from the Premier of Ontario, a timeline for measures. So by mid-January, hoping to end the vaccine passport. By the end of March, hoping to end all public health measures for the pandemic. And you write, there it is there. What is the effect of announcing an end to vaccine requirements by March? Making it much harder to end vaccine requirements by March. By robbing the vaccine hesitant of a crucial motivator, this is a self-defeating prophecy. Just so dumb, for emphasis. You're not the first person to raise these concerns. But I'm wondering if you'd give us a little bit more of a take on this. What should the province have done? And now that it's done the other, is there any way to sort of get back on track?
Yeah, I think it's just an unforced error. Listen, all of us would be really happy to see that we don't need vaccine passports by March. There's nothing that all of us want more than that. But by announcing that, by projecting that out now, you've kind of taken that motivation away from people who are still on the fence about this. We've got about 15%, 17% of eligible people who haven't gotten vaccinated. We think that probably up to 1/3 of those people are truly what you would call anti-vax. They believe in conspiracy theories. They really will be hard to move across the finish line. But about 2/3 of those people can be moved. And it's things like vaccine passports, things like making it inconvenient not to be vaccinated. That is getting them vaccinated. That's been clear that when vaccine passports came in, a whole bunch of people got vaccinated, and that continues. Now you've sort of given them a finish line. You've given them a date that they can look forward to and say, well, if I just get through to March, I don't have to get vaccinated. And ironically, what that'll do is it'll make it harder for us to get to herd immunity. That's our goal here. If we want to lift vaccine passports, we've got to have really low infection rates. We've got to basically have herd immunity. We've got to have the unvaccinated protected by the vaccinated. You need a whole bunch more people to get vaccinated. And this is going to take that away from them. And I just don't see why they needed to do it. If we get there in March, we lift the vaccine passport requirement. Fantastic. But don't say this now and make it harder to get there. And also, nobody should be projecting 5 months out in this pandemic, Heather. We've learned better by now. It's like saying the TSX is going to be at, 30,000 in March. Come on. I mean,
that is
just don't do
definitely
that.
a lesson that we have learned over these months together. Thank you, Dr. Gupta. Appreciate it as always, and see you next week.
See you. My pleasure.